Hello, my name is Malin Heppert,
I'm Karina Sanchez.
I'm Madison Sadler.
I'm Tori Brooks.
And I'm Cassidy Jacoby.
and this is our health policy brief for our country of Zimbabwe. So we, the Secretaries of Public Health in Zimbabwe, would like to brief you, the Ministry of Health and Child Care in Zimbabwe, on the current HIV epidemic or HIV/AIDS epidemic that is currently sweeping the country. In this presentation, we will be going over a brief overview of the country, the nature of the disease within the country, risk factors associated with HIV/AIDS, the social and economic consequences of the virus, as well as recommendations to combat the epidemic.
Okay, so we're going to start with an overview of the country. So our country is a landlocked country in Southern Africa that's surrounded by Mozambique, Zambia, Botswana, Namibia, and South Africa. We are a low-income country with a GDP per capita of about $2,000. In comparison, the GDP per capita in the United States is about $63,000. We are a country that is rich in natural resources such as coal, gold, nickel, copper, and other precious metals, meaning that most of our income is going to come from the mining industry. Our population is about 15 million people, which is primarily made up of individuals under the age of 15 due to our high mortality and high fertility rates. Our life expectancy at birth sits at about 63.3 years currently, and our infant mortality rate is 28.5 deaths per 1,000 live births, which is quite high. We have a presidential republic government with legislative, judicial, and executive branches. Our president currently is President Emerson Mnangagwa. And since he came into the presidency, there has been a lot of danger and unrest economically, politically, and socially, with high levels of drug use, human trafficking, and politically based violence. Our healthcare system is mostly public, with some mission hospitals and non-governmental organizations helping out as well. But ultimately, it's breaking down due to a shortage of providers and funding. And due to all of these things, our citizens, a lot of them are lacking necessary health care that they need, and as a result are unhealthy. And this is just a map of our country.
So this is just an overview of HIV and AIDS. So HIV and AIDS is a viral disease that affects the body's immune system and is contracted through shared needles, which would be blood, sex, which would be vaginal or rectal fluids and semen, and mother to baby, which would just be sharing the body with the baby, and breast milk. That presents as flu-like symptoms and it suppresses your immune system. For prevention, the recommended prevention is using condoms during sex, never sharing needles or syringes, and being very careful around shared blood, and taking medicine to not transmit it during pregnancy, which is a treatment for HIV, and it's called antiretroviral therapy, or ART, and it can reduce the levels of HIV in the blood. It cannot cure it though, but it can be prescribed, and there are different options such as pills and shots. It cannot be cured, but there are many treatments that can suppress the symptoms. And about 38 million people in the world have HIV, and about 1.23 million of those happen to be in our country. And the HIV epidemic started around the late 1980s in our country, and over half of the Zimbabweans that have HIV are women. And this is also passed down to children, which makes our numbers higher because, like Madison said, our fertility rate is very high.
Some of the risk factors for Zimbabwe is the lack of resources, religion, and economic status. In 2017, Zimbabwe's physicians and doctors spoke out against the government. They were requesting funding for the hospital to buy more equipment, such as needles, surgical gloves, medication, and bandages. As in religious, in Zimbabwe, there's a lot of apostolic women. A study was shown that women were unaware of the risk factors of not wearing a condom can cause HIV/AIDS. Zimbabwe's low economic status is caused by hyperinflation that has led to prostitution.
So the magnitude of the problem in our country is immense. We had a tremendous impact on our country's societal life, economy, and government. As of 2022, more than 1.3 million Zimbabweans have been infected with HIV/AIDS since the 1990s. With the most prevalence in the sections of South and North Matabeleland, with around 22 to 23% in both of those sections of the number of cases of HIV being there. While the incidence of HIV/AIDS has slowed down over the last decade, millions of Zimbabweans have been directly and indirectly affected by the epidemic, as well as we're still seeing around 30,000 to 50,000 new cases every year. So to start off, the economic impact, it has had a pretty detrimental impact on our country's GDP over the last 3 decades. Between the years of 1994 and 2003, it is estimated that the virus had dealt a $103.67 billion loss in nominal GDP output, which is huge. But it is important to highlight that this shows that there needs to be an update on the figures and costs of HIV to let other countries know how we're doing and how much we're spending in terms of dealing with this epidemic. Uh, Patients infected with HIV/AIDS are more likely to spend more for healthcare compared to those not infected with HIV or AIDS. This means that people who spend their money getting healthcare and treatment may not be able to afford essential items like food, water, shelter, and other vital things. And this also goes to show if people choose not to get treatment, that means that they're not paying to be treated, which means they're more likely to die from this disease and let it further progress. Untreated individuals may not be able to work due to the conditions associated with HIV and AIDS. If you cannot work, this kind of deals a blow to the microeconomy. If you can't work, you are unable to provide for yourself and your family. This means you cannot provide, you can't get food, you can't get water, you can't get medication, you can't get shelter. So this has dealt a massive blow to the microeconomy as well as the macroeconomy. If we don't have the workforce, we don't receive money from that. We lose GDP, and that deals a blow to our overall economy. And finally, the agricultural field is greatly impacted by the epidemic. One study found that a lot of farmers with HIV/AIDS got sick at peak crop seasons, which means they were unable to give food out or allow or provide food to the country. And it also showed that we lost a lot of money due to that. So the societal impact, the major population at risk for society impact is children. They're at extreme risk of experiencing indirect and direct consequences of HIV. Children who have HIV and AIDS are more likely to not be in school. According to UNAIDS, around 10% of Zimbabwean adults said that they did not want children with HIV in schools. And this just kind of shows that a lot of children who have HIV are stigmatized. An indirect consequence of HIV is that parents of children who have, or the children who have parents with HIV who die, cause these children to become orphanized, meaning that our country has a huge orphan problem. A lot of children do not have parents and do not have shelter due to HIV and AIDS. Most of the stigma surrounding the virus is attached to the LGBT community, especially among men who have sex with men and transgender women, and also sex workers. UNAIDS estimates that 8.1% of men and 10.1% of trans people do not seek medical care due to stigma, and it's even worse with sex workers, which 34% of sex workers do not receive medical care. And finally, Zimbabweans are losing trust in government as a result of a lack of response to the epidemic over the last few decades and political instability that has arisen as a result.
So now we're going to be talking about priority steps. So the first step we have is to provide education on safe sex practices and precautionary cleanliness measures, and to supply adequate testing resources to everyone. Also to implement prevention of mother-to-child transmission programs in the hospitals and health services. Next, to administer and make pre-exposure prophylaxis PrEP more widely available. Also, to make antiretroviral therapy more accessible for all patients. Next, to pledge to meet goals on the Fight Against AIDS campaign, which the Joint United Nations program just made in hopes of it being a fast-track strategy at ending this epidemic by 2030. Next, seeking foreign aid to help with the epidemic. The U.S. approved a relief plan consisting of $213 million to help treat those infected with both diseases and to provide prevention measures. The Network Access Control and AC has put into place a new approach to eradication, including host intrusion prevention, antivirus, and vulnerability assessments.
We'd like to thank you for taking the time to look over our health policy brief, and we do hope that you take our recommendations into consideration when deciding what to do when dealing with this epidemic that is ravaging the country. Thank you.